As India reports over 300,000 new cases of COVID-19 a day, hospitals are being forced to turn away the sick and dying. The Indian government is rushing oxygen to overwhelmed medical centers by planes and trains, but there isn't enough. Doctors are now appealing to the world for help.
When you walk outside the hospitals and you see that rush and people calling frantic calls, crying on the phone that please can you help me for a bed, and all that I can say is yes, I'm trying. Who would ever think there would be a shortage of oxygen to breathe? It's like terrible.
Ventilators are being packed into trucks from the UK heading for India.
The aim is to provide the support that the Indians need at their hour of need, really, if judging by the distressing scenes we've seen.
The U.S. government is also pledging to send aid immediately.
There's discussions about really ramping up what we can do on the ground, oxygen supplies, drugs, tests, PPE, as well as taking a look in the intermediate and long run about how we can get vaccines to these individuals.
Crematories are overloaded with corpses. Desperate residents are searching on the black market for oxygen tanks and the COVID treatment drug remdesivir, any weapon to save their lives or their loved ones.
We are facing a deep crisis. The smaller hospitals are getting closed because of the supply chain issue of oxygen, and more burden is coming on the larger hospitals.
India thought the worst of the pandemic was over. Restrictions had been lifted. The government even allowed this huge Hindu festival earlier this month. But now people are dying in the streets.
In this second wave, the cases are increasing exponentially. There is scarcity of beds, there is scarcity of oxygen, there is scarcity of everything.
Less than 2% of India's population is fully vaccinated against COVID-19. It is currently administering about 3 million doses a day, but some areas have run out of vaccine supplies as this deadly surge continues to spread. Jennifer Johnson, Global News, Washington.